Sex, the word, is not a new word any longer because they have been teaching you how you should try to prevent yourselves not to get pregnant.
Before the Youth for Health project, access to sexual and reproductive health service was limited. Stigma, lack of knowledge, and poor infrastructure prevented many girls from seeking care.
Sierra Leone is not a country where you talk about some certain health issues as a girl and you would not be judged, or you would not be questioned or looked a certain way.
Confidentiality, it was a big problem because there is no special place for the service provider. And the teenagers, they do feel it very difficult to access the service.
There's some fairness in me. How can I access the system? And how can I boldly meet someone working in the health facilities and explain my problems and all of that? And in my community that I live in, which is the God-rich community, there are not much health facilities, except you have to come to the central part of Freetown where you have good hospitals.
My journey before joining the health club was somehow rough because the rate of teenage pregnancy was too much. So it was very rough, but now it's somehow smooth.
We engage the families, we do home visitation, we engage them one-to-one. Because something they used to ignore and take it as a taboo. You know, when you want to conveniently talk about that, you need to meet the person, have privacy with him, educate him, give him other examples which others have gone through and have succeeded, so that he or she may see reason and be a change agent.
Coming of the Youth for Health project made the taboo of discussing sexual and reproductive health and rights in Sierra Leone limited. Yeah, you go into communities, you start to speak to their children about sexual and reproductive health and rights. They think you want to teach their kids bad stuff. But now Youth for Health breaks it down to the community, to a young girl like me, to kids, by sharing age-appropriate information. And now we can be able to discuss what we feel, how we feel, and then by these discussions, we know where to get help.
We used to have a lot of dropouts because of pregnancy, unwanted pregnancy, pregnancy which they cannot care for themselves, being students. And so we have more retention in schools now by school pupils, and the lives on them, in fact, that used to put at danger, because when they are pregnant, they will bring native herbs, traditional herbs to destroy the pregnancy. These were all dangerous acts they have been engaged in. But with this effort, the youth, they got the education, and now there is much improvement.
Initially, they thought I was just there to intimidate them or telling them things that don't matter to them. How? Telling them about sex and contraceptives. They thought I was there to mislead them initially. But by going round with my co-mentor, telling them about this teenage pregnancy and the use of these contraceptives, some of them are happy to receive us. After disseminating this information, some came to us again, say, wow, we are sorry, we thought it's just something that won't benefit us. But after hearing what you are trying to say to us, we now know it's for our own good.
The Y4H project improved my access to the health services when they opened my eyes to how I can also help others access the systems. So I got my help by helping others. I was able to access all the services and know about the services when I came into the advocacy field as a champion for Y4H and help other young adolescents access the health and care services. I was able to feel inclusive and included in making health decisions and in the health issues for girls and adolescents. So I could remember when we went for the workshop in Addis, the preparations here and the works we have been doing here, from the radio station to the school clubs, to the talk shows, to the conferences and to the seminars that we have. A young person like me, I felt included. So I was able to speak for other young people, to be able to have access to these facilities. I was able to reach the grassroots people to know their problems and see how best I can help as a young person. And personally, I now know my health rights and I can now stand up for myself when it comes to my health decisions.
When I was not part of the school health club, I was so anxious about sex. But since when I adapt myself into the school health club, wherein Marie Stopes conducted a workshop wherein they taught us that as an adolescent, we should not engage into sexual activities, that we should abstain, from sex. They also taught us on the after effects of early sex. So like when I get back home, I sat down and I suggested, to withdraw myself.
The changes that I have seen towards their attitude towards HRN's project is that now they listen. Even when they hear the word sex, they are no longer shy. They are outspoken now. They listen to their colleagues, they listen to the champions whilst they are talking. And their attitudes, they no longer frown their faces. They even come and meet me to ask me questions about their health.
Through the Youth for Health project, thousands of adolescents are now accessing youth-friendly services, confidently and without fear.
We have been conducting assembly sensitization. We have been also doing drama.
Through the school clubs, we organized and participated in school debates, school competitions, outreach, media engagement, and community engagement. And one of the fascinating things is that in all of these meetings, to the highest, from the lowest level to the highest level, all these engagements, young people like myself and my other colleagues and friends were also part of it. So in sharing what I've learned with regards to SIHR to my peers, I make it like a normal conversation. It's just like us talking about maybe schoolwork, or to my fellow girls, us talking about a new hairstyle. So I don't approach my peers as if it is something strict or not to be spoken about. I encourage them to have a safe space between ourselves, in communities, in schools, even at my home. That is why I start my advocacy with regards to SIHR, and then I take it to my community and to other young people. So it's a normal conversation, as it should be. That is how we have it.
Children should be involved in decision concerning their well-being because it is for them. They are the direct beneficiary. As they are children, when you catch them young, you'll be able to get what you want from them, because as they grow, the knowledge they've learned will always be part of them.
So when I traveled from Freetown all the way to Port Loko and Cambia to actually speak to the health workers at the DHMT, the DMOs and all of that, I felt empowered. I felt like the Youth for Health project does not want to know my age as a limit, but want to use my age as a source of empowerment for other young people. That was one of the most best moments, and that was the moment I felt so empowered in speaking up for adolescents' access to sexual reproductive health and rights facilities.
The project is not just about access, it's about empowerment. Empowerment of young girls, of community, and of future generations.
My vision for health in our communities, for our youth, is that there is brighter future. Because people are now aware of their very steps. Without health education, I think that will make us have a brighter future.
Our people have become used to it, coming to the clinics or wherever we are going during our outreach session, they access it. We hope that they will take up it again so that it will continue. It will not stop at this time.
It will be a shock to us, a disappointment if this project should stop at this time, when the awareness has so risen up and people are all the time at our doors asking for more ideas, more drugs, and more benefits.
To the donors, the project was amazing. It has impacted us in advocating out to people. It has made us bold and outstanding, outspoken. And I would also like the donors to add the numbers of champions from 10 to above, so we can be in pairs whenever we want to go out and advocate to any environment, any schools at all, or any place.
I'd want to say thank you, because when all other donors saw that SIHR is not an issue that is pressing, you took it as a pressing issue and you funded us young people to be included in these activities. We know that the Youth for Health project is coming to an end. However, the empowerment, the skills, the support that you have shown young people like us will forever live on, and we are the legacy of your investments. We hope to see more projects that will come and help young people in advocating for sexual and reproductive health and rights, because you have funded champions. You have built a future generation of advocates and voices that will not be stopped in speaking about access to sexual and reproductive health and rights and the health and the well-being of young people.